Are your periods painful? Are you having trouble conceiving? Do you have pain during sex? You might be having endometriosis. Have you heard about it before? Are you or someone in your family suffering from endometriosis? I am Dr. ESHA Chakravarti, consultant gynecologist in Vijayalakshmi Medical Center. Let's learn about endometriosis. Did you know 1 in every 10 women suffers from endometriosis? About 190 million women worldwide and 26 million women in India alone are suffering from endometriosis. Yet, it is often misdiagnosed or missed altogether. Lack of awareness is a big reason why endometriosis is often missed. In fact, endometriosis was only identified as a disease only in the 1920s. What is endometriosis? Endometriosis is a condition where the inner layer of the uterus, that is called the endometrium, is growing outside of it. Now, it can grow anywhere inside your abdomen, usually found on the structures surrounding the uterus like tubes, ovaries, vagina, rectum, etc. These unusual tissues are called endometriotic implants. Endometriosis usually affects women in the reproductive age group, that is from the age of 15 up to the age 44 years. You must be wondering who all gets endometriosis. Let's look at the causes of endometriosis. It usually runs in families. It could be genetic, could be immune related, could also be caused due to something called retrograde menstruation, which means the period blood which is supposed to be flushed out from the vagina often goes back into the abdomen, which is normal, but for some women it causes endometriosis. Another cause is called surgical scar implantation, which means that if you have had a previous uterine surgery like a C-section, a fibroid removal, bits of this inner layer can get inadvertently transferred out into the abdomen. These grow and produce endometriosis. Symptoms of endometriosis. It includes painful periods, irregular periods, difficulty conceiving, pain during sexual intercourse, chronic back pain or pelvic pain, diarrhea, constipation and bloating. Let's see what complications does endometriosis cause. It can lead to adhesion formation, that is scar tissue formation between pelvic organs. If these scar tissue form on or around tubes, it will cause blockage or twisting and cause infertility in an otherwise healthy couple. If these are deep infiltrating, they can cause blockage of the intestine and various other symptoms. It can also cause ovarian cysts called chocolate cysts. These cysts can bleed or rupture and cause severe pain. It can also cause something called DIE, that is deep infiltrating endometriosis. This means the implants have penetrated into deeper tissue. For example, if it has infiltrated the intestines, it will cause blockage or twisting. It also has a slightly increased risk of ovarian cancers. Diagnosis. Diagnosis. So how do we diagnose endometriosis? Ultrasound. It is usually the first choice. It should be done with a person with expertise in gynec ultrasounds. Ultrasound helps us identify cysts or collections. Also, pain during ultrasound is an indicator for endometriosis. Based on your ultrasound report, your doctor can ask for MRI. MRI helps us deal with deep infiltrating endometriosis. It also helps us in surgical planning. Another option is laparoscopy. It is a procedure that helps us visualize the inside of the abdomen with a camera via a small incision on the abdomen. It helps us determine the exact location, the number and the extent of the endometriotic implants. Also, a tissue can be taken for sampling. Treatment of endometriosis. Treatment is usually as simple as giving painkillers to offering hormone tablets, hormone-loaded intrauterine devices, up to offering surgery. Now, a customized treatment plan is devised for the patient according to their need. So, if the patient is young and wants pregnancy, she should go for fertility treatment immediately, which might include assisted reproductive techniques like IUI or IVF. If the patient does not want pregnancy, she can try medical therapy or go for surgery depending on the symptoms. If the patient is an older woman with no desire for pregnancy, she can try medical therapy for easement of the symptoms. If not working, she can go for surgery. She might also require removal of uterus and ovaries for the pain. So, coming to the question that must be on your mind, when do I need surgery? Surgery mainly aims at removal of the adhesions. If there's a cyst, removal of the cyst, and often can require removal of uterus and ovaries in older women. So you can need surgery if you have persistent pain in spite of taking medical therapy, or if you have large ovarian cysts which are painful, which is bleeding or which are twisted, or if you are trying to conceive. The big question, can endometriosis be cured completely? The answer is no. Unfortunately, there is no cure for endometriosis. We can only manage symptoms with painkillers, hormone tablets, or actually surgically removing the endometriotic implants. If the patient desires fertility, surgery followed by prompt fertility treatment is required. And for severe cases, usually removing the uterus and ovaries gives relief to the symptoms. Now you must be wondering, what else can I do? Alternative therapies can be tried to make your day-to-day life a little better. For example, you can try stretch exercises or yoga, eat a healthy diet that includes whole foods, fresh produce and lean meats. Also, you can try mindful meditation. Living with endometriosis pain could be very draining physically and emotionally. Hope this has relieved your anxiety about endometriosis and its treatment. Let's help raise awareness together.